Your kidneys have been working for you every single day of your life, and they have almost never complained, not once. That's not a coincidence. That's by design. And for most people, it means that by the time something is actually wrong, the body has already been quietly compensating for months, sometimes years, without sending a single signal you would recognize as serious. If you've recently had a blood test come back with something unusual, or a doctor mentioned your kidney numbers in passing and then moved on before you could ask a follow-up question, that moment is exactly why you're here. This video is not about scaring you. It's about explaining something that most people, including many who are otherwise very health-aware, simply were never told. Here's the thing about kidneys. They are not like your heart, which beats loudly enough for you to feel it change when something goes wrong. They are not like your lungs, which make breathing difficult the moment their function drops. Kidneys are quiet by nature, and they are also extraordinarily resilient. You were born with far more kidney capacity than you actually need to survive. That's not a flaw in the design, it's a built-in safety margin. But it also means that your kidneys can lose a significant portion of their function, somewhere in the range of half, before your body registers anything you would call a symptom. Most people never know this, and that single fact explains more about why kidney disease is diagnosed late than almost anything else in medicine. To understand why the silence happens, you first need a clear picture of what your kidneys are actually doing, because most people's mental image stops at filtering. And while filtering is accurate, it dramatically undersells the complexity of what's happening inside you right now, as you're reading this. Your kidneys are two fist-sized organs sitting just below your rib cage on either side of your spine. Every single minute, roughly 1 liter of blood passes through them. In a single day, your kidneys filter somewhere between 150 and 200 liters of blood in total. What they are doing precisely is separating what your body needs to keep from what it needs to discard, and they are making that decision at a molecular level thousands of times per second. Waste products from normal metabolism, excess minerals, byproducts of medication, and surplus fluid all get pulled out and funneled toward urine. Everything else, the proteins, the red blood cells, the nutrients your body still needs, gets sent back into circulation. But filtering is only the beginning. Your kidneys also regulate blood pressure by controlling how much fluid stays in your bloodstream. They produce a hormone called erythropoietin, which signals your bone marrow to make red blood cells. They activate vitamin D into the form your bones can actually use. They maintain the precise acid-base balance in your blood, the kind of chemical equilibrium that your heart, brain, and muscles depend on to function normally. When a doctor says the kidneys are doing a lot more than most people realize, this is what they mean. Now, here's where the silence begins to make sense. Imagine your kidney function as a reservoir. You start life with that reservoir full, let's say 100%. As long as the level stays above 50%, your body doesn't sound an alarm. It has enough in reserve that it can redistribute the workload, compensate for the loss, and continue operating within normal range. Blood pressure stays controlled, red blood cell production stays adequate, waste products stay within manageable levels. You feel nothing. This compensation is not your body hiding something from you. It's your body doing exactly what it was built to do: adapt, redistribute, maintain. The problem is that adaptation has a ceiling, and the warning signs that do eventually appear, fatigue, slightly swollen ankles, a faint change in how often you need to use the bathroom, are so non-specific that most people attribute them to aging, or a bad night's sleep, or simply the accumulation of years. They are not wrong to think that. Those same symptoms describe dozens of conditions, most of them minor. And that ambiguity is precisely what makes kidney disease so easy to overlook until it has progressed well beyond the point of early intervention. There's another layer to this that is worth understanding, and it has to do with how the kidneys respond to injury. When kidney tissue is damaged by high blood pressure sustained over years,
by blood sugar levels that have been running slightly too high for too long, by certain medications taken regularly, or by repeated episodes of dehydration, the kidneys do not simply decline, they scar. Tiny filtering units called nephrons, each one a microscopic structure responsible for processing a small portion of your blood, become damaged and stop working. Your body cannot grow new nephrons, but the remaining healthy nephrons will expand and take on extra load, a process called hyperfiltration, to compensate for the ones that are gone. Think of it like a team. If 3 members of a 10-person team quietly stop doing their work, the other 7 pick up the slack. The project still gets done. From the outside, looking at the output, everything looks fine. It's only when you look closely at how hard the remaining 7 are working and realize they're burning out faster because of it that you understand the problem isn't solved, it's delayed. And the harder those remaining nephrons work to compensate, the more vulnerable they become to damage themselves. This is why kidney disease tends to follow a particular trajectory in people who don't know it's there. Early loss is invisible. Middle stage loss is masked by compensation. And by the time symptoms arrive that are distinct enough to send someone to a doctor, symptoms like significant fatigue that sleep doesn't fix, persistent swelling in the legs and feet, changes in urine output or color, confusion, or a blood pressure that suddenly becomes difficult to control, the reservoir may already be below 30%. At that level, compensation is no longer keeping pace, and the body begins to show what it has been quietly managing for years. What makes this trajectory particularly significant for the age group most affected is that the 2 leading causes of chronic kidney disease, high blood pressure and type 2 diabetes, are themselves conditions that often develop gradually and without traumatic symptoms.
A person can have blood pressure that's been running 10 or 15 points too high for a decade and feel entirely normal. Blood sugar that's been slightly elevated for years may produce fatigue that's chalked up to getting older. The kidney damage those conditions cause accumulates in the background, quietly and consistently, while the person living inside that body continues their day. The moment that changes everything, for those who are fortunate enough to have it, is a routine blood test. Specifically, a value called creatinine and the number derived from it called eGFR, which stands for Estimated Glomerular Filtration Rate. This is the number that measures how efficiently your kidneys are actually filtering your blood. And here is what is significant. This number can be sitting in your lab results right now, flagged or not flagged, depending on your lab's reference ranges. And most people either don't see it, don't know what it means, or were told it was a little low without any follow-up explanation. An eGFR above 90 is considered normal. Between 60 and 89, there may be mild changes worth monitoring. Below 60, you are in a range that warrants a conversation with a nephrologist, a kidney specialist, regardless of how you feel. Below 30, the kidneys are working at less than a third of normal capacity, and planning for more intensive intervention becomes necessary. Below 15, kidney failure is imminent. Most people who learn their eGFR is in the 50s or 60s for the first time are not sick. They are not in pain. They went in for a cholesterol check or a general physical, and the number appeared on a printout they may or may not have read carefully. That is the window. That is precisely the moment when the trajectory can be changed, not with dramatic intervention, but with information, monitoring, and a few specific changes that have genuine evidence behind them. The silence of kidney disease is not a mystery once you understand the mechanism. It is a predictable consequence of how resilient these organs are and how effectively the body compensates for gradual loss. But that silence is not permanent. It ends, either in a lab result you notice and act on, or in symptoms that arrive after the window for early intervention has already passed. The most important thing you can take from understanding all of this is not anxiety, it is orientation. You now know why someone can have meaningful kidney disease and feel perfectly well.
You know why the symptoms that do appear, the tiredness, the mild swelling, the slightly off sleep, are so easy to rationalize away. And you know that the system of compensation your body uses, while remarkable, has a limit that is worth finding before it finds you. If you have had a blood test in the past 2 years, there is one specific thing you can do this week. Pull out those results, either from a printed copy, a patient portal, or by calling your doctor's office and asking for them, and look for the eGFR value and creatinine level. If you don't see them, ask for them at your next appointment and request that they be explained to you in plain terms. That single number tells you more about where your kidneys stand right now than any symptom or feeling ever could. Not because something is necessarily wrong, there is a strong possibility it is entirely normal, but because knowing is the only position from which you can make an informed decision about what comes next. Your kidneys have been quietly doing their job for decades. The least you can do is take one look at how they're doing.